Hi everyone, welcome to another video. I was going through my basement the other day, clearing away a few old documents, as we all do, and I came across this. And this was a letter which was sent to me at the height of the pandemic, when everyone was being urged to get the shots. But the interesting thing was, this was sent to me in the United Kingdom, at my prior address, and I got hold of it, and bear in mind, I hadn't even lived in the United Kingdom for over 10 years at that stage. I don't think I was officially registered at that particular GP practice. But yet they found the resources to send me this letter. And basically, it's urging me to get the shot as soon as possible. I must get it, necessary for my health. And when I looked at this letter, it really made me think about how resources were allocated at that time. Bear in mind that this particular virus, which was a cold in most people, in fact, statistically, most people didn't have any symptoms. Of course, a few people were very badly affected, but think about everything else going on and everything else regarding health that we should be thinking about. And we're still recovering from the devastating pandemic response now. The healthcare system still has a big backlog that they're blaming on the pandemic. And I'm talking specifically here about the United Kingdom, but this could apply to many medical systems in different Western countries. In the United Kingdom right now, there is a healthcare service which is basically falling to pieces and has been for many, many years. It's very sad. I'm invested in it. I know I haven't worked there for a few years, but I trained within the system and I still have very close relatives, friends as well, who use the healthcare system regularly. So I do have an interest in what's going on in the UK. And this is a healthcare system where one struggles these days to get a face-to-face appointment with a GP. It's almost impossible in many parts of the country. I remember when I was younger, when I was a boy in my village, it was so easy to get a GP appointment. You would basically call up, you'd get an appointment the same day. Frequently, the doctor would come to your house. Now it's basically impossible. You have an emergency over there, and there are horror stories of how long an ambulance takes to get to you. These are people who've worked hard their whole lives, paid taxes, and in their moment of need, they can't get an ambulance to take them to hospital in an emergency. You're diagnosed with a serious condition. It could be something requiring surgery. It could be a cancer diagnosis. And it's often a struggle to be seen quickly. Imagine the anxiety involved. But yet this healthcare service during the pandemic found the resources to send out millions of letters like this to people like me, who haven't even lived in the country for over 10 years, urging us to get the shot ASAP for our health. What about all of the other aspects of people's health? What about everything else that they need help with? In fact, I've told you this story before. I went back a few times to the UK during the height of the pandemic, and they had pretty strict rules over there, lockdown rules. Other things were good about the UK, like they didn't enforce mandates. Employers didn't enforce shot mandates like they did in many countries like the USA. But in the UK, they did have a much stricter lockdown that actually wouldn't have been tolerated in the USA, that type of lockdown. But I remember when I went back, I had to stay indoors for 7 to 10 days, and this was nothing to do with whether anyone received the shot or not. It was a mandatory rule, even if you tested negative. In fact, you had to test, I think it was 2 or 3 times during that period. They would make you buy test kits. Of course, there were other agendas and conflicts of interest. A ton of these companies made a ton of money, and there have been stories since then about how many politicians have been linked financially with many of these testing companies. But regardless of that, when I was stuck at home, because I did adhere to the rules, I stayed indoors 7 to 10 days. I remember representatives, so-called representatives of the healthcare service, would come over, randomly knock on my door, and they would be wearing these bright green tops, wearing an NHS badge, asking if we were home. They would kind of cover it up with a statement like, seeing if you're okay, seeing if you need help, but actually the main goal was to check whether you were in or outside the house, and if you were outside the house, you would be fined several £1,000s, so $10,000 or so. Many people did get fined during that time, but of course, the main goal was to catch people and make some money. That's what they were doing. And think about the resources involved. Hundreds, thousands of people going around checking on whether people are at home or not. This is a system which is completely breaking right now. the National Healthcare Service. And I take no pleasure in saying that. People are really struggling in the UK to get good healthcare, but I want you all to remember, next time you can't get an appointment, next time you're struggling on a hospital waiting list, next time you call an ambulance and it won't come quickly, remember that the healthcare system in the UK had enough resources to send people who don't even live in the country, haven't lived in the country for over a decade, letters like this, because it was so important that everybody gets the shot ASAP. That was their main goal, and they were all in on that. But such a shame that they can't be all in on everything else that is so important to people's health. That's all I've got to say about that. Thanks everyone for watching. Check out my website, my health programs, and my free downloads. Those links are down below. Hit the like button if you like this video, and the bell button for more similar videos in the future. We will speak again very soon.